Hello, I am Dr. Beck, the Executive Director. Welcome to the Thompson Student Healthcare Services here at the University of South Carolina. I hear you have some questions about the student services and some possible suggestions.
Hi there. My name is Jasmine and I'm a senior here at USC. I feel very strongly about improving the healthcare services in the aspect of affordability as well as accessibility for the students here at USC. Many college students face the struggle of access to affordable healthcare services at the collegiate level. I even did some research on the health issues college students face. The University of South Carolina does offer many services covered under the student health fee, but also excludes many frequently necessary services college students require. Because of this, college students may deny further treatment and services and consequently miss necessary classes and fall behind because of required medication and treatment, or spread illness and infect others with threatening bacteria and viruses. Many students here at the university have financial restrictions. I, myself, know firsthand how it feels to suffer from illness and sickness at the university and not have the money to pay for the necessary and required treatment. Due to the financial restrictions many college students struggle with, more extensive services through the Thompson Student Health Center should be enforced in order to number 1, extend services to more full-time college students and number 2, include more health services and procedures under the student health fee. So Dr. Beck, I have a question. What is the goal of the university?
Well, Jasmine, the goal of any university is to ensure safety and health to all the students and faculty. I want nothing more than to hear your personal perspective on the health service we as a university provide. Earlier you mentioned you did some research. Would you mind telling about some of the research you've found about the health of college students?
Okay, well, one thing I remember researching was that according to California State University, general health findings of all college students included that 54% of college students suffered back pain, 48%. Reported allergy problems, 15.2% reported depression, 12% anxiety, 10.9%. Contracted strep throat, 4% reported genital warts/HPV, 3.5% admitted substance abuse problems, and etc. So Dr. Beck, would you mind telling me how much the student health fee is each year and what that fee, that every University of South Carolina student is required to pay, covers? And what it does not cover?
Well, Jasmine, the current student health fee is $169 and includes office visits for the treatment of routine and chronic illness but excluding orthopedic, sport medicine, physical therapy, and psychiatric services. It also covers 12 counseling sessions per academic year, biofeedback services, support groups, preventative health screenings, and fitness nutritional consultations. The fee does not include radiology, laboratory services, EKG, prescriptions, physical exams, massage therapy, metabolic rate testing, medical supplies used during treatment, flu or allergy, shots, or minor surgical procedures.
Oh, okay, thank you. Well, unfortunately not. Everyone on campus is healthy and different students suffer many different conditions and illness. Therefore, I believe it is important for the University of South Carolina to pay attention and attend to the special needs of their students' health.
This all sounds really great, Jasmine. Do you have any recommendations for action from the student health care services here at the University of South Carolina?
Oh yes, Dr. Beck. I believe the healthcare services at the University of South Carolina require minor adjustments in order to become more accessible and affordable to the full-time undergraduate students. First, the University of South Carolina must come up with a survey for all undergraduate students establishing what health issues most affect the individual students and exactly what services and medical equipment is necessary for the health center. Secondly, I think the student health fee of $169 for full-time students should extend its coverage to not only office visits but also include laboratory testing. It would also be the university's responsibility to create a budget cap on these laboratory services. Lastly, I think the student health fee should include certain seasonal vaccinations based on the needs the health survey entails in order to prevent the most commonly college-spread viruses such as the flu. This would decrease the infection of fast-spreading contagious viruses regardless of the student's current financial status. I think our campus should have a mission to protect its students so health is ensured to most students. What do you think the university should focus on in order to improve our health service coverage?
Well, the university should begin to focus on affordability pertaining to the student's health in more depth. I see how health issues and health-related costs have an immense impact on the quality of students' academic life at higher-level institutions. Therefore, it is our responsibility as a collegiate institution to pay special attention to our specific campus health needs and issues. I can understand your point on how it is highly significant to take an in-depth look at a student as a complex and make the necessary adjustments to economically accommodate the students and their health. I will look into your considerations as soon as possible.
I am so glad you understand and respect my advice. I thank you for your time and I am looking forward to hearing from you in the near future. Goodbye, Doctor.
See you soon, Jasmine. Cheerio.